Pranam to everybody, and I'm thankful to the organizers for giving me this opportunity to share my thoughts with you. And as you reflected, the topic of my talk is high blood pressure and kidney failure. As a nephrologist or as a kidney doctor, we see a lot of hypertension or high blood pressure related ailments that eventually lead to kidney failure. In fact, the kidney failure is a disease which is universally, almost universally, accompanied by hypertension. No matter what the cause of the kidney failure is, hypertension is part and parcel of the package that comes with a kidney disease. Contrary to that, the benign hypertension or essential hypertension or high blood pressure in layman's language also leads to the kidney failure. So the both things are true that most kidney disease patients, regardless of their cause, have high blood pressure, and most hypertensive patients or high blood pressure patients may develop the kidney failure eventually. And the nature of the kidney disease is such that it tends to be progressive disease if not checked in early on in its early stages. And for that reason, it's very important that we talk today in this seminar as to what the contributions of the yoga can be for the treatment of hypertensive related disorders, especially the kidney failure. You'll also be hearing later in this speaker series from an endocrinologist about diabetes. And I must mention here that together with diabetes and high blood pressure, these two diseases are responsible for nearly 2/3 to 3/4 of the kidney failure patients. If you were to guess somebody's cause of the kidney failure, and if you mention their cause of the kidney failure without knowing is high blood pressure or diabetes, you will be right 3/4 number of the times, even without knowing it. So that's how common the diabetes and high blood pressure are as the cause for the kidney failure. And as I mentioned, that these disorder, especially after a certain amount of the damage to the kidney has been inflicted by these two disorders or one of them, the nature of this disease tends to be progressive. And if the progression is not checked, it will lead to need for the dialysis or need for the kidney transplantation. As we know very well, that dialysis is very expensive and dialysis is not widely available, nor is kidney transplantation inexpensive or widely available throughout the globe, except for the rich and well-developed nations. I'm not talking about America. We are dealing today on this International Yoga Day with global event, a global problem. And in addition to the pandemic that we are dealing with currently of coronavirus, prior to this pandemic, in fact, for several decades, we have been dealing with the pandemic of the high blood pressure and pandemic of diabetes is so prevalent in many and most countries globally, such that incidence and prevalence of the kidney failure has been increasing over the years and over the decades. And hence, the importance of how we can prevent ourselves from developing kidney failure or how we can control the kidney failure as well as controlling the blood pressure and diabetes with the help of the yoga. In fact, with me being in the series of the talks where I am, my talk has been made easier by several speakers that came before me who have already mentioned as to what the benefits and what the advantages of a daily yoga practice or a regular consistent yoga practice is. The treatment of high blood pressure and the diabetes involves medications, but in addition to medication, because they're both chronic diseases and they are diseases of the lifestyle, modification of the lifestyle is a must part and parcel of the treatment of these diseases in addition to medication. Because these diseases are chronic diseases, they're also associated with chronic inflammation. And chronic inflammation is driven by the stress of not only the disease itself, but the stress of the modern day, fast-paced, stressful life. And all of these factors that contribute to the progression of the kidney diseases can be tackled with a daily yoga practice. On this note, I must also mention to you that I have a strong family history of diabetes and high blood pressure in my mother, who is now 80, and I'm 64. I've been a student of yoga now for nearly 15 or more years. And I came in touch with Guruji about 14 years ago in Milwaukee when he started the yoga practice through the platform of the Hindu Temple of Wisconsin with many of the founding members who are present on this speaker panel here. And I have stayed away from developing high blood pressure or diabetes despite leading a stressful life in many ways by virtue of work and by virtue of many other conditions. And I'm proud to say that I've stayed away from these two diseases, probably because of my regular yoga practice, even though it may not have been as regular as many of my other colleagues and other speakers in this speaker series may have had. Yet, I attribute that despite my strong family history, I am doing well because of a personal yoga practice that I've adopted for many years. And I thank you, the Sahi Yoga Foundation, for this, and Guruji for this, that yoga became a part and parcel of my life a few years ago. All the 8 limbs of the yoga, of Ashtanga yoga, as prescribed by Patanjali, will lead to a certain discipline of mind and a certain physical fitness in our body that is so conducive to control of the blood pressure and the control of the diabetes. And control of the blood pressure and control of the diabetes are part and parcel of preventing the kidney disease and its progression. Even when the kidney disease has been established and cannot be reversed as its nature is after a certain amount of the damage has been introduced, we can at least slow the progression of the chronic kidney disease and postpone the development of the end-stage renal disease by many years or decades sometimes, or we can avoid the need for the dialysis or kidney transplantation eventually. Because yoga allows us the discipline that is needed for handling the chronic disease. Yoga allows us the steadiness of the mind that would allow us to take our medication, go for our appointments, not miss out on anything and everything that needs to be done for treating these disorders and preventing the progression of the chronic kidney disease. I must also say, through experience, I have come to realize that our single greatest wealth that we all possess is our mental health. And mental health without any and every form of yoga, in whatever form that may be, is almost impossible. With practice of the yoga in any and every form, we can have a steady mind and we can have a sound mental health, which is our greatest wealth. Because when we have a good mental health, then we can deal with any and every adversity in our life, including any bodily illness, whether that is high blood pressure or diabetes or obesity or sleep apnea or cancer or any other condition. For that reason, I would highly recommend that we all adopt a regular and consistent yoga practice in our life. Or if we already have a practice, then we intensify it and do not spare any effort in making it a consistent and a regular practice on a daily basis or intensify it further so that we continue to derive the benefits from it. I once again thank you, the organizers of Sahi Yoga, with whom I've been associated even before the foundation was formed. I'm also grateful to the organizers for allowing me to share this platform with many dignitaries who have been on the speakers panel today. And I've learned a lot, like Dr. Nanda also said, I've been listening to all the presentations. I may also want to add that I personally know among the speaker panels, as well as in many of my family and friend circle, that who have been able to avoid taking medication and who have been able to reverse the disease, ghastly diseases as diabetes, by their yoga practice. And they have gone on to reverse their disease or diabetes and high blood pressure to the extent of not taking medication. So I'm by no means prescribing that yoga can heal or cure your diabetes or cure your hypertension. But if checked on early, in early stages before it gets hold of you, when we are in the stages of pre-diabetes or pre-hypertension, we can control these diseases and root it out to the extent that we never have to take any medication and we never have to succumb to any injections of insulin or other medications that may be required for diabetes. However, let it not be perceived differently or erroneously that once the diseases such as diabetes and high blood pressure have established in our body, when they have started leading to the development of the kidney failure, then it's very hard to reverse the disease or cure the disease. When we have gotten to that stage, then our task becomes to take our medications, to follow the doctor's advice, and consistently be compliant with the regimen that has been prescribed to us. And that can be easily done if our minds are steady and if our body is fit and if we have a certain amount of discipline and physical fitness that would allow us to carry on the treatment of the kidney disease and related complications. Many of the other conditions that are part and parcel of hypertension and diabetes related kidney failure have already been alluded to by Dr. Santosh and many other speakers, as well as Swamijis that expounded on our scriptural knowledges from Vedic times. And on that note, I once again thank you, the organizers, for allowing me to share this valuable platform with you all today. And I congratulate the team, Utsahi Yoga team, for arranging this seminar on International Yoga Day. And any questions in future, I would be happy to answer them personally to any of the speakers or participants who are watching this presentation today. And thank you, Vijay, again. And thank you, everybody. And thank you for allowing me to be on the speakers panel.